Safe medication administration. Medicines are safe when used as prescribed or as directed on the label. There are risks in taking any medicine, vitamin, or other supplement. An adverse drug event, ADE, is when a medication causes harm to someone. ADEs include allergic reactions, side effects, over-medication, and medication errors. They are a serious public health threat. ADEs are a preventable patient safety problem. Medics and nurses always remember to safely administer medications. Here are some common medications and a quick guide to when to hold these medications and why. Digoxin. Digoxin used to control some heart problems, such as irregular heartbeats, arrhythmias, including atrial fibrillation. It can also help to manage the symptoms of heart failure, usually with other medicines. Hold this medication if heart rate is less than 60 beats per minute. Reason for this is it slows the heart even more. Giving it can cause severe bradycardia. Always check apical pulse first. Beta blocker. Beta blockers are a class of medications primarily used to treat heart conditions like high blood pressure, abnormal heart rhythms, and chest pain, angina. Hold this medication if heart rate is less than 60 beats per minute or blood pressure is less than 90/60. Reason for this is it lowers both heart rate and blood pressure. Giving it to a hypotensive or bradycardic patient can cause complications. Furosemide is used to treat edema excess fluid held in body tissues caused by various medical problems. Furosemide is in a class of medications called diuretics, or water pills. Hold this medication if potassium is less than 3.5 or what we call hypokalemia. Reason for this is it causes more potassium loss. Giving it now can trigger arrhythmias. Fix potassium deficiency first. Warfarin. Warfarin is an oral anticoagulant commonly used to treat and prevent blood clots, prophylaxis and treatment of venous thrombosis and a rising pulmonary embolism. Hold this medication if INR, called the International Normalized Ratio, is greater than 3.5. The reason behind is that bleeding risk is too high. The blood is already too thin. Check INR and hold until it is safe. Lisinopril. Lisinopril is an angiotensin-converting enzyme, or ACE inhibitor prescribed to manage hypertension and reduce cardiovascular strain. As a competitive ACE inhibitor, lisinopril prevents the conversion of angiotensin 1 to angiotensin 2, a potent vasoconstrictor. Hold this medication if potassium level is greater than 5.0 or patient has renal failure. ACE inhibitors can increase potassium. Don't give the medication if patient is already hyperkalemic or kidneys are failing to excrete potassium. Insulin. Insulin is crucial for maintaining healthy blood sugar levels and preventing hyperglycemia, or high blood sugar. It regulates the metabolism of carbohydrates, fats, and protein by promoting the absorption of glucose from the blood into cells of the liver, fat, and skeletal muscles. Hold insulin if blood glucose is less than 70. There is a risk of hypoglycemia and unconsciousness. Hold the medication and treat low blood sugar. Morphine. Morphine sulfate is a type of opiate and a type of analgesic, pain reliever. This blocks pain signals and changes how the body responds to pain. Hold this medication if respiratory rate is less than 12 per minute. Morphine suppresses the respiratory drive. Giving it when respiratory rate is already low can lead to respiratory arrest. Therefore, opioids compromise the cortical and sensory drive but also the brainstem neurons that control breathing when arousal is low. Metformin. Metformin is used to treat high blood sugar levels that are caused by a type of diabetes mellitus, or sugar diabetes called type 2 diabetes. Metformin lowers your blood sugar levels by improving the way your body handles insulin. It's usually prescribed for diabetes when diet and exercise alone have not been enough to control your blood sugar levels. Hold metformin if patient is scheduled for CT with contrast. This is done to minimize the risk of contrast-induced nephropathy, CIN, and subsequent lactic acidosis, a potentially serious complication associated with metformin and iodinated contrast agents. Hold 48 hours before and after contrast unless renal function is cleared. Nitroglycerin. Nitroglycerin is a vasodilatory drug used primarily to provide relief from inguinal chest pain. It is currently FDA approved for the acute relief of an attack or acute prophylaxis of angina pectoris secondary to coronary artery disease. Hold this medication if systolic blood pressure is lower than 90 mmHg. This medication drops blood pressure fast. Don't give if the patient is already hypotensive. The patient could crash. Monitor the pulse and blood pressure every 5 to 15 minutes. Heparin. Heparin is an anticoagulant, or what we call blood thinner, that stops your blood from forming blood clots or making them bigger. Heparin works rapidly and is typically administered intravenously or subcutaneously, while warfarin has a slower onset and is usually taken orally. Hold this medication if platelets is less than 100,000 platelets per microliter of blood or signs of heparin-induced thrombocytopenia or HIT. Heparin-induced thrombocytopenia or HIT is a rare but serious complication of heparin therapy where the body forms antibodies against heparin, leading to a paradoxical increase in the risk of blood clots. In essence, HIT is a potentially dangerous immune reaction to heparin treatment. Giving it now may increase bleeding. Recognizing life-threatening drug side effects. When it comes to medication, understanding the potential side effects is essential for ensuring your health and safety. Recognizing and being aware of drug side effects allows you to take prompt action if any concerns arise. Knowing when not to give a drug can prevent life-threatening complications. Always check heart rate, INR, glucose, and more before administering. Every small decision we make at the bedside matters. Hope you have learned something. See you in the next one. Don't forget to like and subscribe.